Yellow fever. Overview. Yellow fever is a viral hemorrhagic disease caused by the yellow fever virus, a member of the flavivirus genus. It is primarily transmitted to humans through the bite of infected mosquitoes, especially Aedes aegypti and Haemococcus species. The disease is endemic in tropical and subtropical regions of Africa and Central/South America. Key facts about yellow fever. Transmission. 1. Mosquito bites. In sylvatic, jungle, cycles, the virus circulates between non-human primates and mosquitoes. In urban cycles, infected mosquitoes transmit the virus to humans in densely populated areas. 2. Human-to-human spread. Yellow fever cannot be transmitted directly from person to person. Only mosquitoes can spread it. Symptoms. Yellow fever has an incubation period of 3 to 6 days. Symptoms progress through two main phases. 1. Acute phase. Fever. Headache. Muscle pain, especially in the back. Chills. Nausea and vomiting. Weakness. These symptoms usually resolve within a few days, but in some cases, the disease progresses to the toxic phase. 2. Toxic phase, severe cases. 15% of patients. Jaundice. Yellowing of the skin and eyes, giving the disease its name. Abdominal pain. Vomiting, sometimes with blood. Bleeding from the nose, mouth, or eyes. Organ failure, liver and kidneys. The toxic phase is life-threatening and has a high fatality rate. Complications. Liver damage. Causes jaundice and impaired liver function. Kidney failure. Leads to reduced urine output. Hemorrhage. Due to damage to blood vessels. Shock and death. In severe cases, multi-organ failure can occur. Diagnosis. Laboratory tests. Blood tests to detect viral RNA or antigens. Serological tests for yellow fever antibodies. Clinical history. Recent travel to endemic regions may raise suspicion. Treatment. There is no specific antiviral treatment for yellow fever. Care is supportive and includes 1. Rest and hydration. Oral or intravenous fluids to prevent dehydration. 2. Symptom management. Pain relievers like acetaminophen, avoiding aspirin to reduce bleeding risk. 3. Hospitalization. Critical care for severe cases, such as managing organ failure or blood transfusions. Prevention. 1. Vaccination. A single dose of the yellow fever vaccine provides lifelong immunity for most people. Vaccination is mandatory for travel to certain countries and recommended for those visiting endemic areas. 2. Mosquito control. Use insect repellents and protective clothing. Sleep under mosquito nets in affected regions. Eliminate standing water to reduce mosquito breeding sites. 3. Public health measures. Mass vaccination campaigns in outbreak-prone areas. Surveillance to detect and control outbreaks early. Global impact. Yellow fever is a major public health concern, particularly in sub-Saharan Africa and tropical South America. Large outbreaks occur periodically, especially in areas with low vaccination coverage. Travelers to endemic regions must ensure vaccination and take mosquito prevention measures. Current status. Yellow fever remains a vaccine-preventable disease. Efforts by the World Health Organization, WHO, and global health agencies focus on expanding vaccine access in endemic regions, conducting outbreak containment and mosquito control, raising awareness about prevention,